Hello everyone, Dr. Allan Mandell here. If you're over 60, walking is good, but it is not enough anymore. And I know that might surprise you because for decades, walking has been sold as the ultimate exercise for aging bodies. But science has evolved, and so has our understanding of how the body changes after 60. As a clinician, I'm telling you this clearly and honestly. There are 5 simple exercises that do more for your heart, joints, brain, balance, and longevity than walking alone, and they are approved by orthopedic surgeons and geriatric specialists worldwide. These movements don't just keep you moving, they reverse muscle loss, restore circulation, protect your spine, and reduce fall risk, the #1 cause of injury-related death in seniors. Let's break this down. After age 60, 3 things accelerate rapidly: muscle loss, called sarcopenia, joint stiffness from cartilage dehydration, and nerve slowing, which affects balance and coordination. Walking does not adequately stop any of these. So let's talk about what does. After the age of 60, the most dangerous moment of your entire day is not when you walk outside, not when you climb stairs, not even when you drive a car. It is the moment you stand up from a chair. That simple movement, standing up, has quietly become one of the strongest predictors of whether you will live independently or slowly lose control of your body. Medical journals now confirm something shocking. The ability to rise from a seated position without assistance is more closely linked to lifespan than blood pressure, cholesterol, or body weight. And the exercise that protects this ability better than almost anything else is the chair squat. Every year after age 60, the human body loses muscle at an accelerating rate. This process is called sarcopenia, and it is not gentle. Research shows adults can lose up to 1% of muscle mass every year after 60, and the loss is fastest in the legs and hips. These are not cosmetic muscles, these are survival muscles. They control balance, protect joints, stabilize the spine, and absorb impact with every step. When they weaken, the body compensates poorly. Knees collapse inward, hips stiffen, the lower back absorbs stress it was never designed to handle, and falls become not a possibility but an expectation. Here's the fact most people never hear. More than 90% of hip fractures occur after a fall from standing height or less. Not car accidents, not ladders, standing up, sitting down, losing balance for a split second. Once a hip fractures after 60, mortality skyrockets. Studies published in orthopedic journals show that up to 1 in 3 seniors dies within a year after a hip fracture, not from the bone break itself, but from the rapid loss of mobility that follows. Muscles shut down, blood flow decreases, the heart weakens, infections rise, independence disappears. Chair squats directly interrupt this cascade. When you perform a chair squat, you activate the largest muscle groups in the human body: the gluteus maximus, quadriceps, hamstrings, and deep core stabilizers. These muscles are metabolic powerhouses. They act like sponges for blood sugar, pulling glucose out of the bloodstream and into muscle cells where it can be used for energy. This is why strength-based movements like chair squats dramatically improve insulin sensitivity. In fact, research from the Journal of Gerontology shows that improving leg strength in older adults significantly reduces the risk of type 2 diabetes, even without weight loss. But the benefits go far beyond blood sugar. Every controlled descent into a chair sends pressure through the knee joint that stimulates the production of synovial fluid, the lubricant of your joints. Cartilage has no direct blood supply. It survives by movement. Without regular compression and release, cartilage dries out, thins, and cracks. This is why sitting too much actually accelerates arthritis. Chair squats gently nourish the knees and hips, restoring movement where stiffness once lived. Orthopedic surgeons often prescribe this exact motion after joint replacement, not because it is easy, but because it is biologically correct. There is also a neurological effect that most people never consider. Standing up requires the brain, spinal cord, and peripheral nerves to communicate in perfect sequence. Chair squats retrain this communication. They strengthen motor unit recruitment, the ability of the brain to activate muscle fibers efficiently. As we age, this connection weakens, which is why movements feel slower and less coordinated. Research in neurophysiology shows that resistance-based movements, like squats, can restore nerve signaling speed even in adults over 70. This is not about muscle alone. This is about keeping the brain physically connected to the body. Then there is bone. Bones respond to stress. Not random stress, but controlled loading. Chair squats load the femur, pelvis, and lumbar spine in a way that stimulates osteoblasts, the cells responsible for building bone. Walking does not provide enough vertical loading to significantly slow bone loss. Chair squats do. Studies in osteoporosis prevention show that lower body strength exercises increase bone mineral density more effectively than walking alone. This is not optional information. One fall plus weak bones equals a fracture. Strong bones turn falls into recoveries instead of disasters. And perhaps the most underestimated benefit is hormonal. Yes, even after 60. Large muscle activation stimulates the release of growth hormone and testosterone, both essential for tissue repair, fat metabolism, and energy levels. While levels naturally decline with age, resistance movements slow that decline. Research confirms that older adults who perform regular lower body strength exercises maintain higher anabolic hormone activity than sedentary peers. This directly affects energy, sleep quality, and immune function. Now here is the most important part. Chair squats restore dignity. When someone can no longer stand up without using their hands, assistance soon follows. Then devices, then dependence. The psychological impact is devastating. Loss of confidence leads to less movement. Less movement accelerates weakness. This downward spiral happens quietly, often within months. Chair squats reverse the direction. They teach the body, I can support myself. They teach the brain, I am still capable. They teach the joints, movement is safe. And they do it without gyms, machines, or risk. You begin by sitting in a sturdy chair, feet flat on the ground, chest tall. You lean slightly forward, not collapsing but engaging the core. You stand up slowly, feeling the muscles work. Then you sit back down under control. No momentum, no dropping, just control. At first it may feel difficult. That is not failure. That is awakening tissue that has been asleep for years. Even 5 repetitions a day begin to send powerful signals through the body. 10 repetitions build resilience. 15 repetitions rebuild confidence. Studies show that seniors who can perform repeated sit-to-stand movements have dramatically lower rates of disability, hospitalization, and early death. This is not fitness. This is survival training. And the most shocking truth of all is this. People do not lose independence because they get old. They get old because they stop challenging their muscles in meaningful ways. Chair squats are not flashy, they are not trendy, but they may be the single most important movement you can do after 60 to protect your future. Because every time you stand up on your own, you are not just moving your body, you are choosing independence. After the age of 60, the body begins to collapse forward without you even noticing. The shoulders round, the head drifts ahead of the spine, the chest caves inward, and with that silent shift, something far more dangerous happens inside the body. Your lungs lose space, your heart works harder, your digestion slows, and your brain receives less oxygen. This is not posture as an appearance problem. This is posture as a survival issue. And one of the simplest movements capable of reversing this internal collapse is the wall push-up. Here is the shocking truth backed by medical imaging. Poor upper body strength and posture can reduce lung capacity by up to 30% in older adults. That means every breath delivers less oxygen to the brain, the heart, and the muscles. Less oxygen means fatigue, dizziness, brain fog, and increased risk of heart disease. This is why many seniors feel tired even when they are not doing anything. Their body is working harder just to breathe. Wall push-ups directly attack this problem at its root. When you place your hands on a wall and slowly lower your body forward, you activate the chest muscles, shoulders, arms, and most importantly, the deep stabilizing muscles of the upper back. These muscles are responsible for holding the shoulders back and the chest open. When they weaken, gravity wins, and gravity is relentless. Research published in geriatric rehabilitation journals shows that upper body strength training significantly improves respiratory efficiency in older adults, even without any direct breathing exercises. Why? Because when posture improves, the rib cage can expand fully, the diaphragm can descend properly, oxygen exchange improves immediately. This is not theoretical, it is measurable, but breathing is only the beginning. Wall push-ups also protect one of the most vulnerable areas of the aging body, the shoulders. Shoulder pain is one of the leading causes of sleep disturbance in seniors, and sleep deprivation accelerates cognitive decline. weakens immunity, and increases inflammation throughout the body. Many shoulder injuries after 60 are not caused by trauma. They are caused by weakness and instability. The rotator cuff muscles lose strength. The joint loses control. Tendons become irritated. Pain becomes constant. Wall push-ups gently strengthen the rotator cuff and shoulder stabilizers without compressing the joint. Unlike floor push-ups or heavy weights, the wall provides controlled resistance. Orthopedic specialists frequently recommend wall-based pushing movements after shoulder surgery because they restore strength without risking injury. That same principle makes wall push-ups ideal for preventing shoulder problems before they begin. There's also a bone strengthening effect that most people overlook. Bones respond to pressure and pull. When you push against a wall, force travels through the wrists, forearms, elbows, shoulders, and collarbone. This stimulates bone-forming cells called osteoblasts. Studies on bone density show that weight-bearing exercises for the upper body reduce fracture risk in the wrists and arms, two of the most common fracture sites during falls. Walking does nothing for these bones. Wall push-ups do. And then there is the heart. Upper body movements increase heart rate differently than lower body movements. They challenge the cardiovascular system in a unique way, improving circulation to the brain and upper organs. Research shows that combined upper and lower body activity leads to better blood pressure control than walking alone. Wall push-ups increase circulation to the arms and chest, reducing stiffness and improving vascular health. Now let's talk about the nervous system. As we age, nerve signals slow down. Reaction time decreases. Coordination suffers. Wall push-ups require controlled movement, balance, and body awareness. This stimulates proprioception, the brain's ability to sense where the body is in space. Improving proprioception reduces fall risk because the body responds faster when balance is challenged. Neurological studies show that resistance-based movements enhance neural plasticity even in adults over 75. That means the brain can still adapt, it can still improve, but only if it is challenged. There is also a powerful hormonal response. Upper body resistance movements stimulate the release of endorphins, dopamine, and growth hormone. These chemicals improve mood, reduce pain perception, and support tissue repair. This is why many people feel mentally sharper and emotionally calmer after strength-based exercise. Depression and anxiety are not just psychological in older adults. They are often physiological. Movement changes chemistry. One of the most overlooked benefits of wall push-ups is how they restore confidence. Many seniors stop using their arms fully. They avoid pushing, lifting, or reaching because they fear pain or injury. Over time, this creates learned weakness. The brain begins to believe the arms are fragile. Wall push-ups safely retrain the brain to trust the body again. Each repetition sends a message: I am still strong. I am still capable. And here's a fact that should stop you cold. Grip strength and upper body strength are strong predictors of lifespan. Multiple long-term studies have shown that individuals with greater upper body strength live longer and experience fewer hospitalizations. This is not about aesthetics. This is about resilience. When illness strikes, when balance is lost, when the body is stressed, strength determines recovery. The beauty of wall push-ups is their accessibility. You stand facing a wall, feet shoulder-width apart, hands placed at chest height. You inhale as you lower your body toward the wall, elbows bending gently. You exhale as you push yourself back, slow, controlled, intentional. Even 5 repetitions activate muscles that may not have been fully used in years. 10 repetitions begin to build endurance. 15 repetitions rebuild strength. And unlike many exercises, wall push-ups improve daily life immediately. Reaching overhead becomes easier. Getting out of bed requires less effort. Carrying groceries feels safer. Breathing feels deeper. Posture improves. Pain decreases. Energy increases. This is not exercise for exercise's sake. This is medicine. Medicine for the lungs. Medicine for the heart. Medicine for the brain. Medicine for the bones. And perhaps most importantly, medicine for independence. Because aging does not steal strength overnight, it takes it slowly, silently, through disuse. Wall push-ups interrupt that theft. They are quiet, they are simple, but their impact is profound. And the most powerful truth of all is this: strength is not lost because of age. It is lost because the body is no longer asked to be strong. After the age of 60, the most dangerous enemy of the human body is not heart disease, not cancer, not even diabetes. It is loss of balance. One misplaced step, one moment of hesitation, one fraction of a second where the brain fails to communicate with the feet. And in that instant, a life can permanently change. Medical data is brutally clear. Falls are the leading cause of injury-related death in older adults, and the majority of those falls happen during ordinary movements, walking across a room, turning around, or stepping off a curb. No warning, no second chance. What most people do not realize is that balance is not a muscle problem. It is a brain problem. Balance is controlled by a complex communication network between the brain, the inner ear, the eyes, the spinal cord, and the sensory nerves in the feet. This system is called proprioception, and after 60, it begins to fade quietly. Nerve endings in the feet become less sensitive. Reaction time slows. The brain receives delayed or distorted information about where the body is in space. That is why many seniors say, "I don't feel steady anymore," even when their legs appear strong. Here is the shocking truth backed by neuroscience. Balance can decline even in people who walk every day. Walking forward on flat ground does not challenge the balance system enough to maintain it. The brain adapts only when it is challenged. Without challenge, neural pathways weaken, and once those pathways weaken, falls become inevitable. This is where the heel-to-toe balance walk becomes life-changing. This simple movement looks harmless, almost too simple to matter, but neurologically, it is one of the most powerful exercises an older adult can perform. Heel-to-toe walking forces the brain to slow down, focus, and re-establish precise communication with the body. Every step demands accuracy. Every step requires the nervous system to recalibrate. Research published in neurology and geriatric medicine journals shows that balance training can reduce fall risk by up to 40%. That is not a small improvement. That is the difference between independence and injury, between confidence and fear, between living at home and living under supervision. The reason this works is profound. When you place one foot directly in front of the other, heel touching toe, the base of support becomes extremely narrow. The body can no longer rely on momentum. It must rely on control. The brain is forced to activate stabilizing muscles in the ankles, knees, hips, and core simultaneously. More importantly, it activates sensory nerves in the feet that have been dormant for years. Studies using nerve conduction tests show that balance exercises increase sensory feedback from the feet to the brain. This improves reaction time. That means when the ground is uneven, when a rug slips, when a shoe catches, the body responds faster. Faster response means fewer falls, and the statistics are terrifying. 1 in 3 adults over 65 falls every year. Half of them fall again. Falls are the leading cause of traumatic brain injury in seniors. Even a fall without a fracture can cause fear that leads to reduced movement. Reduced movement leads to muscle loss. Muscle loss leads to weakness. Weakness leads to more falls. This vicious cycle destroys independence faster than almost any disease. Heel-to-toe walking breaks that cycle at the neurological level. There is also an inner ear connection that most people never hear about. The vestibular system located deep inside the inner ear controls balance and spatial orientation. With age, vestibular function declines. This causes dizziness, unsteadiness, and disorientation. Balance exercises stimulate the vestibular system, forcing it to adapt and strengthen. Clinical studies show that targeted balance training improves vestibular function even in adults over 75. That means fewer dizzy spells, fewer sudden losses of balance, fewer emergency room visits. Now let's talk about the brain itself. Balance training increases activity in the cerebellum, the part of the brain responsible for coordination and movement precision. Brain imaging studies reveal that balance exercises increase neural connectivity in this region. This is not just about preventing falls. This is about maintaining brain health. The cerebellum is also involved in attention, memory, and emotional regulation. When it is stimulated, cognitive function improves. This is why balance training has been shown to slow cognitive decline in older adults. The brain stays sharper because it is being challenged in meaningful ways. Movement becomes mental exercise. And then there is posture. Heel-to-toe walking naturally encourages upright posture. The head aligns over the spine. The core engages. The shoulders stabilize. This improves spinal alignment and reduces strain on the lower back. Poor posture shifts the center of gravity forward, increasing fall risk. Restoring alignment restores stability. Another overlooked benefit is joint protection. Balance walking strengthens the small stabilizing muscles around the ankles and knees. These muscles protect the joints during sudden movements. Weak stabilizers mean the joint absorbs shock directly, increasing the risk of sprains and tears. Strong stabilizers act like shock absorbers. Orthopedic research shows that improved ankle strength significantly reduces fall-related injuries. And here's a fact that should change how you view balance forever. Fear of falling increases fall risk. When the brain is afraid, movement becomes stiff and hesitant. Reaction time slows. Balance worsens. This is called the fear avoidance cycle. Heel-to-toe walking restores confidence. Each successful step tells the brain, I can do this. Confidence improves movement quality. Movement quality reduces falls. This is not psychological motivation. This is neurobiology. Balance training also improves circulation to the brain. Controlled movement enhances blood flow through the carotid arteries. Better blood flow means better oxygen delivery. Better oxygen delivery means improved alertness and reduced fatigue. Many seniors report feeling more mentally clear after balance exercises, not because they are tired, but because their brain is better nourished. Now consider this. Most falls happen not because of weakness, but because of distraction. Turning the head, reaching for something, changing direction, heel-to-toe walking trains the brain to maintain balance even when attention shifts. This is called dual task training. Neurological studies show that balance exercises improve multitasking ability, reducing fall risk during everyday activities. The practice itself is simple, but the impact is profound. You stand near a wall or counter for safety. You place one foot directly in front of the other, heel touching toe. You take slow, deliberate steps. You breathe calmly. You focus. 10 steps forward, 10 steps back. That is all it takes to awaken a system that may have been neglected for decades. Even a few minutes a day can rewire the nervous system. And here's the most powerful truth of all. Balance is not lost because of age. It is lost because the brain stops being challenged to maintain it. When balance disappears, independence soon follows. When independence disappears, quality of life collapses. But the body is not fragile. It is adaptive. Neuroscience proves this. The brain retains plasticity far longer than once believed. It can form new connections. It can strengthen old ones, but only if it is asked to. Heel-to-toe walking asks. It asks the brain to wake up. It asks the nerves to reconnect. It asks the body to trust itself again. This is not just an exercise. It is a message to the nervous system that says, I am still here. I am still capable. I am still in control.